Hello, coders. Good evening. Welcome to your Track 2 group study. Tonight we will be covering digestive, urinary, and male and female. How do you feel about that? And I had to say, it's an honor for me to be here tonight. For those of you who don't know, you usually don't hear my voice on Track 2. However, I will be filling in for the wonderful Miss Rochelle tonight. She had some things that she had to take care of, so I told her I'd be glad to spend the evening with you all. So again, I want to welcome you all to our group study, and I want to thank you all for coming in. Okay, and I just want to take a peek, see who's all here tonight. Say hello, and let me know. We were talking about weather on the other side, how the weather is right now. I think it is fall. I think it's officially fall. Correct me if I'm wrong, but it is really hot where I'm at. So it's in the 90s. And I was just looking at the weather for San Francisco, which is a little bit above me, northwest. And it's usually never above, 60s and 70s there. Today it's 90. So I bet they're miserable over there. How's everybody? Okay, so it looks like it's hot and steamy in Houston. Oh, yeah, that's true. Better to be hot and steamy than have the floods. I did hear about all that flooding over there, so have y'all in prayer. That was terrible. Can't even imagine. Someone says it's hot in North Carolina. I know you're probably dealing with some of that humidity over there, huh? Okay, all right. Well, I'm going to introduce my wonderful team here. Someone else says it's 60s. Wow, you're lucky. You're like Miss Sarah. You guys are having that beautiful weather, 60s in Washington State. Supposed to get snow this weekend. Okay. I don't know if Miss Sarah's expecting snow, but all right. So I want to welcome, first up, we have Miss Bennett. Hi, Miss Bennett. How are you? And how is your weather where you're at?
Hello, Miss Tracy. Hello, coders. It's actually gorgeous. I think today's high was 87 or something, but we had limited humidity, and for Ohio, that is fantastic.
Beautiful thing. Awesome. Well, you'll be dealing with snow before long, I'm sure. I think it snows over there in Ohio, in certain parts anyways. All right. Next up, we have Miss Sarah. Hi, Miss Sarah. Did you see that? It's going to be snowing maybe in Washington State this weekend?
Hi, Miss Tracy. I did see that. I don't think Portland will get any because we rarely get snow, but Washington tends to get a little bit more, I think. And hello, Miss Brenda from Washington. You're probably a nice neighbor over there.
Wow, that is incredible to hear. Snow already, and it's not even winter time. So you keep safe over there. Stay safe and warm. And Miss Sarah, you in beautiful Oregon weather.
Yes, thank you.
You're welcome. Okay, and last and certainly not least, we have Miss Tiffany joining us. And hi, Miss Tiffany, how are you? And how is your weather?
Hi, Miss Tracy. Hi, coders. It's hot and humid here. It's 92 today. I'm in New Orleans.
New Orleans. Oh, so you are close to our Miss Rochelle.
Yes.
Yeah, so hot and humid. Well, you stay inside in that nice air conditioning.
I will.
All right, and thank you everybody again for joining us tonight, and we are going to get started. We have a lot of great scenarios planned for you. Okay, so first we want to read the copyright. CPT is copyright of American Medical Association. All rights are reserved. CPC is a registered trademark of AAPC. And keyword concept, FTR, Chun, AMCI, Fab 7, and Flip and Tap are all trademarks of AMCI. Hi, Patricia. Hi, Azora. I just have to look because I know some of you are coming and joining us from part 3. And as I said at the beginning of class, if this is your first night in a group study, go ahead and let me know that in the chat. Or even if it's your first week, some of you may have joined us on Monday. Awesome, Teresa. Awesome. Wow, I see some of you, this is your first time. Well, that makes me happy. I'm so glad you're all in here, and I hope you have a good time. So without further ado, we're going to start with our first scenario. Okay, I'm going to actually, I'll go ahead and read this one because it's really simple. We have preoperative diagnosis is hematuria. Postoperative diagnosis, right renal calculi, and bladder calculus. What ICD-10-CM code is or are reported for this service? And I will give you, we'll start with 2 minutes right now for this one, okay? And your time begins now. Okay, I see some great answers coming in the chat here. Okay, let's go ahead. All right, I still see some answers coming in, so I'm just going to give you just a few more moments to get those answers in. Great job, Christina. Great job, Teresa. Got it, Katoya. Well, a lot of you have got this, or you're really, really, really super close. So let's go ahead and look at what's going on. Oh, I don't know if how long the answer was there. I'm sorry. I just noticed it was on the screen, so hopefully it wasn't there for long. All right, so our keywords, we have postoperative diagnosis is right renal calculi, and we have bladder calculus. So we are not going to code hematuria. Why are we not coding hematuria? Anybody tell me in the chat? That's right. Yes, remember in the setting of a post-op diagnosis, we do not code pre-op, okay? So we do not code that hematuria. So you guys look like you knew that already, so great job. And let's go ahead and look up the We're going to look these up in the index. So first of all, we're dealing with renal calculi, and we're also dealing with bladder calculus, okay? So we're going to look up calculus, our main term in our index, and we're going to go down to renal, okay? And when we scroll down there to renal, it tells us to see calculus kidney, okay? So we're going to go back up to where it says kidney, which is right here. And that gives us a code of N20.0, okay? I see some of you are coding this N20.2, but that says with calculus of the ureter and doesn't mention anything there about the ureter, okay? Just says that we have renal calculi and bladder calculus, okay? So we're going to be stopping here at the kidney calculus, and our code is going to be N20.0. And we also have bladder calculus, so if we look up that, that gives us a code of N21.0. Okay, so we're gonna go and verify those. So N20.0 is our calculus of the kidney, okay, or otherwise known as renal calculus or renal calculi, as you see that listed under this code. And then N21.0 is calculus in bladder, okay. So that's going to be our code. And on this one, it doesn't give us any sequencing guidance, so it doesn't really matter on that one which one goes first. Okay. So let me know if you guys got this. And if so, we'll go ahead and move on. Hi, Brittany. Hi, Elaine. Great job, Kelly. Lavon. Awesome, Patricia. Okay, so let's go ahead and move on to our next one. And Miss Bennett, can you read this one for us, please?
It'll be my pleasure. Are we doing 2.5 minutes, Miss Tracy?
Yeah, that'll be fine. Thank you, Miss Bennett.
You're welcome. A 49582, K42.0, B 49587, K42.0, C 49590, K42.9, and D 49572 and K42.9. A 40-year-old male patient is in the surgical suite to have an incarcerated hernia of his belly button repaired. What are the correct CPT and ICD-10 codes reported? Coders, your time starts now. That's time.
All right, thank you so much, Miss Bennett. Okay. All righty, so I am just waiting to see if we have any more answers coming in here. See, some of you might be checking your answers, reading a little bit more forensically, so I'm just going to give you a few more moments because I do see some answers still coming in here. Okay. All right, I see some of you changing your answers. Awesome. Think you're seeing your mistake. Great job, great job. Okay, so let's go ahead and look at this. All right, so if I look at my answers, looks like they're all pretty close together. They all begin with 495, and then we have some additional codes coming from our ICD-10. So let's first of all look at our CPT codes. But first, the answer is going to be B, okay? So I saw a split, it looks like between B and D. So let's see what the keywords are. We have a 40-year-old, surgical suite, incarcerated hernia, belly button, repaired, okay? So we just have to pay attention to the type of hernia that's going on here. So if we look, first of all, it says we're dealing with an incarcerated hernia of the belly button, okay? So if we look at 49570, which is the parent for 49572, it says repair of epigastric hernia. And we have the keyword there, incarcerated or strangulated. It's basically, that's meaning that it's, the blood supply is being cut off, which is what is happening here. So looking at this, you might say, hey, that looks good. That looks like it's our code. However, we have to look at this. What type of hernia? This says epigastric, okay? So if we refer back to our medical terms, that is above the stomach. That's what that epigastric means, or pertaining to above the stomach. So that would be, if we look at the belly button here, this is going to be above. This hernia is going to be located above the belly button, okay? So we are going to get rid of that based off of the keyword. Okay, everybody following me on that so far? Because we are having an incarcerated hernia of the belly button, okay? Good, okay, perfect. Awesome, awesome. Okay, so get rid of D, and let's move on and look at some more of these codes. So 49580 is the parent for 49582, which is an answer A, and that is for repair of umbilical hernia, okay? That looks like a good keyword because what does the umbilical refer to would be the belly button, right? Okay, and these codes are age driven. So at this code, that's for younger than age 5 years. And our patient is how old? 40 years old, right? So based off the age, that code is going to be wrong, okay? So if we look down at 49582, it does say this is repair umbilical hernia, incarcerated or strangulated. However, this is for the wrong age, okay? So we cannot code that one. So we'll go ahead and get rid of that, okay? So see the way that age is important there. Okay, now we're gonna look at 49587, okay? And that is also for repair of umbilical hernia, incarcerated or strangulated, and there's our age, okay? 5 years or older, all right? So I like that code, but we have to look at all of them. 49590, that is for repair of the Spigelian hernia. And that is basically when the hernia is through the fascia, it's like the fascia, and it's the tissue that is kind of between the abdominal muscles, okay? So that one is not gonna be correct because based off the keyword, this is the wrong type of hernia, okay? So we are going to get rid of C, and that makes B the correct answer, but we're gonna look at K42.0, and that's our diagnosis code for umbilical hernia, okay? With obstruction without gangrene. Alrighty. So we are going to, sorry, there we go. B is the correct answer. All right, I'm going to click in the chat and see if everybody got this, or if anyone has any questions, please feel free to type them in the chat to us. And I'm sorry, but I'm having a problem tonight locating all of my things on my panel, so I apologize for that. Okay, here we go. All right, I'm seeing got it here in the chat. All right, great. Okay, so I have another one for you, and can you do us the honors of reading this one, please, Miss Sarah? I think I might have lost her, unless you're talking and you're on mute, Miss Sarah.
Can you hear me now?
Yes, I can.
Okay. Sorry about that.
Okay, I know, I knew it.
We have A 48520, K 86.1, B 48520, K 85.80, C 48548, K 85.90, D 48548, K 86.1. A 57-year-old patient with chronic pancreatitis presents to the operating room for a pancreatic duct.junum anastomosis at the Puestow type operation. What are the correct CPT and ICD-10-CM codes for this encounter? I'm sorry, I butchered those words, coders. And you guys have 2.5 minutes on this. All right, that's time, coders. You guys are lightning fast on this one.
Yes, they were. Thank you so much, Miss Sarah. Okay, and lightning fast, and you guys really got this one. I want to say 100% on this one. So great job. And great keywords. Keep those keywords coming here in the chat. Love them. Okay. Awesome, I like those keywords. Okay, so let's go ahead and look at this. So when I'm looking at my answers, I notice that A and B share the same first code and C and D share the same first code or same procedure code. Okay, and then we have some ICD-10 codes as well. So our keywords are 57-year-old, chronic pancreatitis, pancreatic duct junum anastomosis, Puestow type operation. And our answer is D. Okay, let's find out why. All right, so first of all, we're going to look at that 48520, and I don't see anyone that chose A and D. It looks like everybody did choose D, so I think we can just quickly go through that. That is for internal anastomosis of pancreatic cyst. Okay, I don't see, first of all, anything mentioned about a cyst. So, and if we look at the other set of codes, so we're going to get rid of A and B, because if we look at this other code, 48548, really it's about following the keywords here. And this is telling us exactly the type of operation that was performed, which is that Puestow type, okay? So we have a pancreatico-jejunostomy and side-to-side anastomosis, okay? And that's what it's saying here, is the pancreatic duct jejunum anastomosis, and the type is the Puestow type operation, okay? So that follows along our keywords. I like that. So great. Great procedure code there. And then again, it comes down to the tiebreaker, because of course those both share the same first listed code. So if we look at K85.90, that is for acute pancreatitis without necrosis or infection unspecified. And K86.1 is for other chronic pancreatitis, and it mentions chronic pancreatitis not otherwise specified there. And in our documentation, it says this patient has chronic pancreatitis. Okay, and it's not specified as to anything else, so we're just going to code it here at K86.1. Okay, and as you all said, D is the correct answer. All right, ready to move on? Let me look in the chat real quick. Perfect. Okay, so I have another one for you, and Miss Tiffany, can you read this one for us, please?
Yes. A, 45385. B, 45380. C, 45378. 45385, modified 51. D, 45378. 45380, modified 51. A patient is seen in a gastroenterologist clinic for a diagnostic colonoscopy. When performing the service, the physician notices suspicious-looking polyps, removes 3 using a snare technique to send to the pathology for further testing. What is or are the CPT codes to report? Is it 2 minutes or 2.5?
Let's do 2.5 if you don't mind.
Okay, coders, you have 2.5 minutes. Miss Tracy, that's time.
Okay, thank you so much, Miss Tiffany. All right, everybody, get your answers in. Great answers so far and awesome keywords. Okay, give you a few more moments. Okay, perfect. Okay, so let's look at our answers here. I see A and B have one code, C and D have two codes, and C and D share the same first listed code, and then we have some modifier 51 on the second code there in the last two answers. Okay, so, and they're all, I noticed they're all very close together, so just gonna require some forensic reading. All right, our answer is A. And my keywords here, I have gastroenterologist, diagnostic colonoscopy, polyps, remove 3, snare technique. Okay, that's pretty much all I need to solve this scenario. Now I'm going to look at this 4, 5, 3, 7, 8. That's in answer C and D. And can anybody tell me why that one is incorrect? Okay, because this is for a colonoscopy flexible diagnostic, including collection of specimens by brushing or washing when performed. And it does say this patient had a diagnostic colonoscopy. So why would that one be incorrect? Yes, that's the keyword I'm looking for. And that's the guideline I'm looking for. So Lavon, you got it. Kim, yes. Let's see, who else? Katoya, yes. Kelly, yes. Great. Okay, so remember, we have to pay attention to that separate procedure. This says separate procedure right there. And also remember our very important guideline that we always mention throughout part 3, our diagnostic scopes are bundled into the surgical scope. Okay, so if a surgery is performed, although a diagnostic scope took place, if a surgery is performed within, during that diagnosis or during that procedure, that diagnostic scope is going to be bundled, meaning it doesn't get coded separately, okay? The only time you would use this 45378, this diagnostic scope here, is if it's unrelated to another procedure, okay? So based off of that, and based off our guideline, we can go ahead and get rid of answer C and D, okay? So next to these codes that are diagnostic, I would put a DX at the code level, just let you know that that is a diagnostic scope. And you might also want to just highlight separate procedure in a different color. That way it stands out to you, you know that's a separate procedure. Okay, so because there was a removal of polyps done here, then this diagnostic scope is turning into a surgical scope, okay? And in the setting of the surgical scope, a diagnostic scope is going to be bundled. All right, so based off of that, great job, everyone. C and D is wrong. Okay, and if we look at 45380, it shares the same parent. So all of these share the same parent, which is a colonoscopy. This is for biopsy, single or multiple. And what was done here was not a biopsy, it was a removal of a polyp, of 3 polyps, okay? So we can go ahead and get rid of that. And then if we look down at 45385, this is for removal of tumors, polyps, or there's the keyword, so it could be any of these or all of these, doesn't matter, other lesions by snare technique. So that's the technique that was used. This was for polyps, and we're only going to code it once because that S right there indicates it could be multiple. Okay, so we don't need a multiplier on here. So we're just coding that once, and always pay attention to the parenthetical guidelines. It says do not report 45385 in conjunction with 45390. That doesn't apply here, but the second one does. Do not report 45385 with 45378, which is an answer C. It's telling us not to do that. So we know right off the bat, that would have been wrong based off of our parenthetical guideline. Okay, so we only need to report 45385 one time, and that's it. You guys did a fabulous job on that one. Let me go ahead and look in the chat. You guys are rocking it though. Okay. Someone says it doesn't show polyp. Are you saying in the scenario? It's right here in the keyword. Not sure if I answered your question. If I didn't, please please type in the chat. I want to make sure that I get your question answered on that polyp removal. Okay. Great job, Isora. Brittany, awesome on that guideline. Okay, so let's go ahead and move on. Okay, perfect, Brenda. Okay, so let's go ahead and move on. I have another one for you. And Miss Bennett, can you read this next one for us, please?
That would be my pleasure. Okay, coders. A 43235, C15.9, B 43248, Q39.3, C 43249, K22.2, and D 43235, K22.2. A patient is admitted for a simple primary examination of the gastrointestinal system to rule out GI cancer. An esophagogastroduodenoscopy EGD is performed, which includes examination of the esophagus, stomach, and portions of the small intestine. During the examination, a stricture of the esophagus is identified and subsequently dilated via balloon dilation 20 millimeter. What CPT and ICD-10-CM codes are reported? Coders, your time starts now. And that's time, coders.
All right, thanks so much, Miss Bennett. And again, another wonderful job by you coders. I see a lot of great answers come in here in the chat. I'm just going to kind of scroll a little bit because I see some of you probably still working on this. So let's look. Yes, I'm seeing great keywords here. And awesome answers. Okay, so let's go ahead, and if you didn't get this correct, that's okay. We're going to walk through it, and I think you'll see your mistake as we go along. So if I'm looking at my answers first, I notice that we have some procedure codes and we have some ICD-10 codes here. And our answer A and D are the same exact code, and B and C are very close together there. So, and then we have, I'm also looking at those category letters. Remember the category letters that we talked about in part 2, C for cancer, Q's for congenital, and then those K's are for digestive. Okay, so those are just some things I like to observe as well. Okay, so my keywords, I have primary examination, gastrointestinal system, esophago-gastroduodenoscopy, EGD, and we have esophagus, stomach, and portions of the small intestine, and esophagus again, and dilated via balloon dilation, 20 millimeters. Okay. So our answer is going to be C, and just looking at my keywords, it looks like we're dealing with the digestive system here. So I can kind of eliminate some things. I don't like to eliminate based off the ICD-10, but I can kind of narrow it down a little bit, but I still want to look at those procedure codes. And let's first look at what's the procedure that's being performed here is an EGD, that dilated via balloon dilation. So if we look at, so something is happening here. There's a surgical procedure that's taken place. And again, if you look at this first, this code 43235, that's for the esophagogastroduodenoscopy diagnostic. Okay, so that's our diagnostic code for that procedure, and something was performed here. So remember, this diagnostic scopes are bundled, okay, into the surgery. So that would be incorrect. So we can get rid of A and we can get rid of D. Okay, and then our next code shares the same parent. Everything here shares the same parent. So again, this is for that EGD with insertion of guide wire followed by passage of dilators through esophagus over guide wire. Okay, so that isn't exactly what happened here in our procedure. Okay, it says insertion of a guide wire. I don't see anything about that. However, if we look down at, we can get rid of B. If we look down at 43249, this is with transendoscopic balloon dilation of esophagus, and it's saying less than a 30 millimeter diameter. Okay, here we have a dilated via balloon dilation, 20 millimeters. Okay, and that falls within that size right there. So we like that code, and that's going to be our answer. And if we look at K22.2, that is for the diagnosis code for esophageal obstruction, or if you look down below, it says stricture of esophagus. Okay, and that's what we're looking for. So we are going to call it and say C is the correct answer. Okay, so go ahead and type in the chat if you got that. If you didn't get it, but you see your mistake, let me know that too. A lot of digestive really is following those keywords, okay, and knowing those guidelines as well, okay. Knowing, you'll be dealing with a lot of, codes like this where it's going to be coding for the diagnostic, but you have to look in your documentation. If there's a surgery, you just have to know that guideline, that diagnostic scope is bundled into that surgery scope. Okay. Perfect, Levon. Awesome, Marquita. Hi, Marquita. Great job, Kim, Levon. Okay, so let's move right along. I have another one for you. And I'm going to ask Miss Sarah if you can read this one for us, please.
Yes, I'd love to. Okay, we have A 42820, B 42821, C 42825, 42830, D 42825, 42835. 7-year-old female presents to the same-day surgery unit for a tonsillectomy. During the surgery, the physician noticed the adenoids are very inflamed and must be taken out as well. The adenoids, although not planned for removal, are removed once the tonsils are taken. What CPT code or codes are reported for this procedure? And coders, you have 2.5 minutes on this one, and I think you'll rock it. And that's time, coders. It looks like we got 100% or at least very close to 100% on this one. You guys did rock it. Great job, coders.
Awesome, perfect. Thank you, Miss Sarah. Okay, well, I can say you guys are doing great in digestive, and that's great. We're going to be moving on in a second to urinary male female. So I want to say you guys just rock this section. So let's look first at our answers. So if I look at my answers, my first listed here, they're all very close together. C and D share the same code, and then we have additional codes there in C and D. So let's look at the answer. It's going to be A. Okay, and I see so many A's flying in the chat, so you guys got this one. Real quickly, our keywords, we have 7-year-old female, same-day surgery. We have a tonsillectomy, adenoids inflamed, taken out. This was not planned for removal, but they were removed after the tonsils were taken out, okay? So this patient came in for a tonsillectomy, ended up having her tonsils and her adenoids removed. So if we look at 42820, this is the code for tonsillectomy and adenoidectomy. And we know if we code this, it has to be both of those procedures had to have been performed. And here, that was the case, okay? And these codes are age driven. So this patient was 7 years old, and this 42820 is for a patient that's younger than 12. So that's a good code. If we look down at 42821, which is in answer B, same procedure, tonsillectomy and adenoidectomy, but this is for age 12 or over. Again, that doesn't fall within the range of our patient, so we can get rid of answer B, okay? And we're gonna just leave that A right there because I like that code, but we always gotta check everything else. And then finally, C and D, we're gonna look at that. Same code, 42825, is for a tonsillectomy, primary or secondary, younger than age 12. So yes, I like that. There was a tonsillectomy that was performed. 42830, which is the second listed code there in C, is for adenoidectomy, and that was also done. However, that's wrong because we have the code. Anytime you have a code that is going to code to a higher specificity, we would use that one code rather than breaking it up and using two, okay? So that's why that one's wrong. And D is wrong because that's coding for just the secondary adenoidectomy, meaning that was performed the second time, okay? So we're coding right here at 42820, just as most of you are saying, and the answer is A. Okay. All right, great job. So how do you guys feel about moving on to urinary? Urinary, male, female. Let me know if you got it. Awesome. Thank you for letting me know. Okay, I hear you. Okay, let's do it. I hear some of you saying, let's do it. You got this. Okay, so moving along to our next section. Urinary and male-female scenarios. So the first one, I'm going to ask Ms. Tiffany if you can read this one for us, please.
Yes. A, 55873, C61. B, 55873, C79.82. C, 55873, D07.5. D, 55875, C61. Prior surgery ablation of the prostate is performed for prostate cancer. What CPT code and ICD-9 codes are reported for this service? Coders, you have 2.5 minutes. Miss Tracy, that's time.
All right. Thank you so much, Miss Tiffany. All right, everyone, get your answers in. We're off to a great start in this section. I'm seeing a lot of great answers and wonderful keywords. So keep those keywords coming. It's really going to help drive you to the correct answer. And let's go ahead and look at this. So A, B, and C are all the same procedure code, and D is our oddball there. Doesn't match the rest. And then we have some diagnosis codes, and I notice in these that we have C category letter and D category letter. Okay, so we have our malignant and our benign there. So let's see what the answer is. Our answer is going to be A. Okay, let's find out why. Our keywords are cryosurgical ablation, prostate cancer. Okay, so our answers are, if we look at our code 55 in answer A, B, and C, that's for cryoablation of prostate. Okay, and that includes guidance and monitoring, ultrasound guidance and monitoring. So 55873, I like that. That's what happened here. We had cryosurgical ablation of the prostate. And if we look at 55875, that's for transperineal placement of needles or catheters into prostate for interstitial radio element application with or without cystoscopy. And I don't see anything mentioned in our scenario about that taking place. So that's going to be the wrong procedure code. So we can go ahead and get rid of answer D. Okay. So now we know what our procedure code is, and now it comes down to those diagnosis codes. Okay, so let's first look at C79.82, and that is coding for a secondary malignant neoplasm of genital organs. Okay, and I don't see this mentioned as a secondary neoplasm. Okay, so we're going to code this as primary. So based off of that, we can go ahead and get rid of answer B. Okay, and then looking at D07.5, this is for carcinoma in situ of the prostate. So that is basically coding for the in situ is just abnormal cells that pretty much haven't spread to the normal tissue yet, so it hasn't become cancerous. So that's what that is. And this patient is being diagnosed with prostate cancer. So we're going to code that as prostate cancer, not in situ. So we would get rid of answer C, okay? And that's a giveaway there because that is our D category, and in A, we have the C category letter, okay? We know C is for cancer, so we're gonna get rid of C, and C61 is malignant neoplasm of prostate, okay? And that is our correct code, so we're gonna choose A as the correct answer. And you guys, most of you, I think, chose A, so great job. So I'm going to take a peek here in the chat, see if we have any questions. Yeah, so the secondary cancer, you know, you might see it, some keywords, it might say secondary, it might say metastasized, things like that. So those are keywords you want to watch out for when you're coding for secondary cancer. Great job. Okay, so let's go ahead and move on. I have another one for you. And can you read this one for us, please, Ms. Bennett?
Absolutely. A, 52352 with modifier 58, B, 52352 with modifier 78, C, 52352 with modifier 76, and D, 52352. Patient is status post-left extracorporeal shockwave therapy, in parentheses ESWL, performed 3 weeks ago. There is no global time for this procedure. He returns today for scheduled left ureteroscopy with basket extraction of ureteral calculi. What CPT code is reported for this service? Encoders, your 2.5 minutes starts now. Okay, that's time.
Okay, thanks so much, Ms. Bennett. Okay, so it looks like we're very, very divided on this scenario. So I'm just kind of scrolling through just to see what everybody's saying. So this is basically testing our knowledge on modifiers, because if we see our first listed code are all the same, okay? The only difference is whether we're going to put a modifier 58, 78, 76, or no modifier, okay? Okay, awesome. I see some good keywords coming here in the chat, and I think this would be a great learning scenario. So let's go ahead and look first at what our answer is. Our answer is going to be D. Yes, no modifier, and I'll tell you why in a second, but let's go to the keywords. We have status post left extracorporeal shock wave therapy was performed 3 weeks ago. Sorry, those keywords are a little bit off there. We don't have any global time, so that should be no global time. And today he's having a left ureteroscopy with basket extraction of ureteral calculi. Okay. All right, so let's go ahead and look. There you go. My keywords are better on this slide. So let's go ahead and look at what that 52352 code is, and that's for the cystourethropy with ureteroscopy, and or piloscopy. And I know I'm not saying those right, but with removal of or manipulation of calculus, and the ureteral catheterization is included. So that's going to be our procedure code, obviously, because it's in every answer there. So let's focus on these keywords. I mean, sorry, not the keywords, the modifiers. I apologize, and the keywords as well. Okay, so if we look at modifier 76, which is there in answer C, this is for a repeat procedure or service by the same physician or other physician, and this was not a repeat procedure, okay? It's saying that this patient came in here 3 weeks ago and had that shockwave therapy, and there's no global time for that extracorporeal shockwave therapy, okay? So the only time that we need a modifier is within the global period. It basically allows the payer, lets the payer know, hey, this takes place in the global period, and this is why, okay? Whether it be a repeat procedure or a stage procedure or an unrelated procedure or something like that, that's when we would append a modifier, okay? So 76 is going to be incorrect because this was not a repeat procedure. It was a different procedure than what was performed before, and we are not in any global time period here. Okay, 58 is modifier 58 in answer A. That's for a staged or related procedure or service during the post-operative period. Okay, that's your keyword there. So if something happened during that post-operative period and it was staged or related, we would append modifier 58. But again, there is no post-op period here because it says no global time. And the same thing with 78. Okay, unplanned return to the operating room. If this patient, say there was a global period on this, and within that global time, the patient did come back for something that was unrelated or it was unplanned, then you could append 78, or if it was, in this case, he was scheduled for this ureteroscopy, it could be maybe it was related to that the previous procedure that he had 3 weeks ago, then in that case, you might be able to report it. But you just have to pay attention to what that global time is. And in this case, there was none. So that means we don't append a modifier. Okay? I feel like I was just talking in circles. Did that make sense? Let me know if not, and I can re-explain it. I see some aha moments. Okay, perfect. So again, just the important thing to remember is if you're within, when the patient comes back, are they within their global period? Okay, so each procedure is allotted a certain amount of time depending on the severity of the procedure. So if it's a major procedure, it's typically given like 90 days. Some procedures, if they're minor, they're given a 10-day global period, and some are not given any. Like if you're just having like a simple scope procedure done in the office, typically doesn't have any global days associated with it. However, say you did a major surgery and it had 90 days and the patient comes back for any reason within that time, that modifier has to be on there, or else the physician will not get paid. The payer will just assume that that's part of that treatment and they won't get paid for it. So that modifier equals money. So if you guys watch the modifier lecture, I kind of go over that more in detail, but I see some aha moments here, so I'm glad to see that. And let me know if anybody else have any questions, and if not, we'll move right along. I have another one for you. I think that was a great learning scenario for us. Okay, so you got it. I don't see any other questions, so let's go ahead and move right along. And Miss Sarah, can you read this one for us, please?
Yes, I'd love to. Okay, we have A 54150, B 54160, C 54150 with modifier 52, D 54160 with modifier 52. A clamp circumcision is performed without dorsal block on a newborn. What CPT code is reported for this service? And would you like 2.5 minutes on this, Miss Tracy?
You know what, let's try 2 minutes on this one, if you don't mind.
All right, 2 minutes, coders. Oh, and that's time, coders.
Okay, thank you, Miss Sarah. Okay, looks like another one y'all rocked. And wow, I can say that mostly everybody that's answering is putting their keywords in here. That's really great to see. Keep those keywords coming. Okay, so we're gonna go, because really that's what's gonna come down to. And a lot of these, like I said, as hopefully you're seeing, is those keywords, okay? And the same, it's the same for this scenario right here. So if we look at our answers, I see that we're just dealing with 2 codes. We have A and C are 54150 and B and D 54160. And then we have some modifiers. We have modifier 52, okay? So our answer is going to be C. And my keywords are clamp circumcision without dorsal block, newborn. Okay, so let's look at the difference between these two codes. Okay, 54150, these are both circumcision codes. Okay, the difference is, so 54150 is using a clamp or other device with a regional dorsal penal or ring block. And 54160 is circumcision other than clamp, okay? Device or dorsal slit, neonate, 28 days of age or less. Okay, so if we look at our scenario, this definitely tells us it's a clamp circumcision. So 54160 is coding for other than clamp, and 54150 is coding for clamp. However, you might say it's saying with dorsal penal or ring block, and our scenario is saying without. So that is kind of contradicting itself. But we're going to get rid of B and D, and I'm going to tell you why A is the correct, A is the correct, no, C is the correct answer. But I'm going to tell you why this code is the correct code. 54150, although this is for a clamp circumcision, and although it does say with dorsal penal or ring block, and this our scenario says that we're coding for, or this procedure was performed without, we have to look at those parenthetical guidelines. That's why it's really important to see what it's telling us. It says do not report modifier 63 in conjunction with 54150. So that doesn't apply here, but that's something to really take note of, okay? Because if you ever see this modifier 63 on 54150, we know that's automatically incorrect. And our second PG here says report 54150 with modifier 52 when performed without dorsal penal or ring block. Okay, so when it's performed without, we would append modifier 52. Okay, just like our guideline says. So that's why A is incorrect and C is the correct answer. If you got this, let me know you got it. Guys are a little bit quiet here in the chat. But I saw a lot of great answers here. It looks like maybe a split between B and C. Okay, great. All right, let's go ahead and move on to our next one. We're going to try to get in as many as we can today, like getting in that practice. So Ms. Tiffany, I'm going to ask you to read this one, and we probably only need 2 minutes for this one as well.
Okay. A, 52234, B, 52224, C, 52240, D, 52235. Transureter resection of a medium-sized 3 centimeters bladder tumor was performed in an outpatient setting. What CPT code is reported for this service? Coders, you have 2 minutes. And that's time, Ms. Tracy.
Okay, thank you so much, Miss Tiffany. All right, I knew you all were going to get this one. I think we have 100%, so I'm just going to quickly go through this one because really it is just following the keywords. These are all coding for the same procedure, so we're just following exactly, just basically comes down to what we're coding for that size. Okay, our answer is going to be D, and our keywords, we have transurethral resection, medium size, 3.0 centimeter bladder tumor, outpatient setting. Okay, so if we look at 52224, that's for cystourethropy. Wait, I always get that tongue twisted on that one. With fulguration, including cryosurgery or laser surgery or treatment of minor. And these are probably some of the things you might want to box to distinguish between each one of these codes. It's going to come down to the size, okay, of that tumor. So minor, that would be less than 0.5 centimeter lesion, okay? And if we look at our scenario, we're coding for a medium size, which is a 3.0 centimeter bladder tumor, okay? So we'll go ahead and get rid of B. If we look at 52234, that is coding for a small bladder tumor, okay? And so if you look up at the top, sorry, that's for a lesion, less than 0.5 lesion or lesions. Now when you get down to this 52234 family, this is coding for your bladder tumors, and it's going to go according to small, medium, and large. And it's already telling us in our scenario it's medium, and so we're going to get rid of answer A, because that's coding for small. 52235 codes for medium, size from 2.0 to 5.0. That falls within the size of the tumor that we're coding for here in the scenario. So that's a great code. And 52240, that's for a large bladder tumor. So that'd be anything over 5 centimeters. Okay, so we'll go ahead and get rid of answer C. And D is the correct answer, as you all said. So great job. Okay, I think we got that one. So we're going to move right along. I have another one for you. And can you read this one for us, please, Miss Bennett? I'm not sure if I was on mute. Was I on mute?
Oh, no, that was just me. Okay. A 52356, LT 52352, modifier 59, and RT. B 52353, modifier LT, 52352 with modifier 59, RT, 52332 with modifier 51 and LT, 5231 C is 52310, 52353 with modifier 51, 52352 with modifier 59, and D 52353 with modifier LT, 52353 with modifier 59 and RT. Cystoscopy, left ureteroscopy, holmium laser lithotripsy, stone manipulation, stent removal, and replacement are performed. The holmium laser was used to break up a cluster of stones at the ureteropelvic junction, which were removed with a basket, and a gibbon stent was exchanged. Previous CT scans showed stones in the lower right pole. It was decided to proceed with ureteroscopy. Ureteroscope was inserted in the right ureter, confirming multiple stones within the proximal ureter. These were basketed and removed. What CPT codes are reported for this service? Coders, your 2.5 minutes starts now. That's time, coders.
Okay, thank you so much, Ms. Bennett. Oh, well, I've seen a lot of great answers coming in here. And this one is probably a little bit more challenging, but I think you guys rock this one too. I've seen a lot of the correct answer. And if you didn't get it correct, that's okay. We'll walk through it together. We're just kind of scrolling through, and I'm liking these keywords too. I think that's really too what's really helping you and driving you to the correct answers, just following those keywords. So, okay, so let's go ahead and look at this. And there's a lot of stuff going on here. We have a lot of codes that we're dealing with. We see some left sides, we see LT modifiers, we see some RT modifiers, modifier 59, and a lot of these codes are pretty close together. Okay, so let's just read forensically, and I'm going to go to my keywords. We have cystoscopy, left ureteroscopy, Holmium laser lithotripsy, stone manipulation, stent removal, and replacement. So those are the things that were performed. Holmium laser broke up the cluster of stones. Uretopelvic or UP junction removed with a basket. Gibbon stent was exchanged. Then there was a ureteroscopy. We have a ureteroscope. Inserted right ureter, multiple stones, proximal ureter. So there's a kind of a lot of keywords there. All right, so our answer is going to be A. And I see a lot of you did say A, so let's go ahead and look at this. So first of all, there's our codes. We're going to look at 52310, since that's kind of what comes first in order if we're looking it up in our manual. So that's for a cystourethropy with removal of foreign body, calculus, or ureteral stent from urethra or bladder, and this says that it is a separate procedure. So this one right here, pay attention to that separate procedure, and the removal of the stent is not coded separately, okay? So that right there, we'll go ahead and get rid of C, and we're going to go on and find out why A is the correct answer. But first, let's look at this 52353. It's an answer, both answer B and D as our first listed. Okay, so this is for a cystourethropy with uretoscopy and or piloscopy. Okay, so we had the cystoscopy there with the uretoscopy. Okay, and this says with lithotripsy, and yes, we did have this that laser lithotripsy that was performed. However, this 52353 is not being as specific as we need it to be. Okay, so that based off of that, that's going to be the incorrect code. Okay, and if we go down to 52356, that is same parent, urethroskopy with uretoscopy and sorry, I'm making myself laugh because these words are crazy, and or piloscopy with lithotripsy. So 52356 is saying with lithotripsy, including insertion of indwelling ureter stent. Example, Gibbons or double J type. Okay, so I see that keyword there, Gibbon stent. Okay, so I like that. I like this code right here, 52356. It's very specific as to what happened. And then, so that's our first listed code. And if we look at, sorry about the key. If we look at the second thing, this is for that 52352. That's with removal or manipulation of the calculus. And that's basically for the removal of those stones, okay? So the calculus is the stones. All right, so we also would need that code as well. Okay, so 52352. So, and if you notice, they're on different sides. So that that first procedure right there with the lithotripsy is going to be performed on the left side, and then the removal of the stones 52352 is going to be on the right side. Okay, and we put a modifier 59 there just to indicate that they are distinct procedures from each other. All right, so I know that was a lot. And A is going to be our correct answer. Okay, so let me know if you got that. All right, I like seeing that aha moment. You see your mistake, that is really truly what matters. So glad to see that. Okay, perfect. So I'm going to go ahead and move right along, and I have another one for you. And Miss Sarah, can you read this one for us, please? And probably only 2 minutes on this one as well.
All right. Yep. Okay, we have A 14040, B 54161 with modifier 22, C 54163, D 14040, 54161 with modifier 51. Circumcision with adjacent tissue transfer was performed on a 2-month-old. What CPT code or codes are reported for the service? And 2 minutes, coders. All right, that's time.
All right, thank you so much, Miss Sarah. And let's see. Give me 1 second, everyone. All right, sorry about that. Okay, so looks like most of us got this. Are we still working on it? Let me know. Okay, still working on it. Okay, I'll give you just a few more moments. Just gonna kind of take a peek and see what everyone's saying here. Good keywords. Great job, Brenda. Awesome, Patricia. Kelly, you got it. Levon, correct. Awesome, awesome. Haji, yes, great job. Kim, that's right. Marquita, perfect. Brittany, great job. Elaine, Excellent. Toya, great. Okay, so let's go ahead and see what's going on here. So looking at my answers, looks like we have some codes from intake. Notice that those 10,000 series codes there, and then we have the 50,000, which is from the urinary section. I have a modifier 22 there that indicates increased procedural services, and then we have our 51, which is multiple services in answer D. Okay, so let's go ahead and, or multiple procedures, I should say. Okay, so let's look at the keywords. We have circumcision, adjacent tissue transfer, 2-month-old. Okay, and our answer is going to be D, right? Let's find out why. Okay, first of all, looking at 14040, which is in both answer A and D, that's for our ATT, okay, or the adjacent tissue transfer. And then those go according to the body area. So this is for forehead, cheeks, chin, mouth, neck, axilla, and genitalia, hands, and our feet. Okay, so this is circumcision. So this would this is a circumcision with adjacent tissue transfer. So of course that is on the genitalia. So we're in the right spot for that. And I like that code. So I'm going to just mark that real quick. And I want to go and look at these other codes, okay, that are listed. So 45161, that is code for circumcision, surgical excision other than clamp device or dorsal slit older than 28 days of age. Okay, our patient is 2 months old. Okay, so I like that code. Okay, and we're going to look at, and that's also in answer D. Okay, so that's our second listed code there in answer D. It's also the code in answer B. Now, in B, it's putting an increased service here, so modifier 22. So it's basically saying, well, we're just going to put modifier 22 on there instead of covering for that ATT. So that would be incorrect. We wouldn't put a modifier on that code, right? And then if you look down at 54163, that's repair for an complete circumcision. And does it mention anything in our scenario about an incomplete circumcision there? So we'll go ahead and get rid of answer C. And so A and B is going to be incorrect because we're going to code both for the adjacent tissue transfer and also for the circumcision. Okay, so we need 2 codes there. And then we append modifier 51 just to indicate multiple procedures. Okay. All right, anybody have any questions here? Let me see. If you got it, let me know you got it. Okay. Perfect. Okay, awesome, awesome. So let's go ahead and, yeah, I know these 2, I know someone said about it doesn't say because these ATTs go according to location and also to size. So I know it doesn't mention a size in here. However, because it's on such a small area, then it's most likely less than that 10 square centimeters there. However, that was our only ATT code to choose from. So in that case, you just pick the best of the 4. Okay. All right, and so we'll go ahead and we'll move on. I have another one for you, and I can't remember. Is this Miss Tiffany?
I think it is.
Okay, go ahead, Miss Tiffany. Thank you. And 2 minutes on this one as well, please.
Okay. A, 50561, B, 50580, C, 50130, and D, 50060. A patient comes in for removal of a calculus from the renal pelvis via renal endoscopy through an established nephrotomy. What CPT code is reported? Coders, you have 2 minutes. Miss Tracy, that's time.
Okay, thank you so much, Ms. Tiffany. All right, I'm gonna give you guys just a few more moments to see some answers still coming in here. Okay, I see a lot of great answers here. Great job following those keywords, okay? I know that these words can be pretty, in this section, I don't know, these words can really throw you off. There's a lot of different words, like here we're dealing with, it says nephrostomy, so we really have to know what that means. It's good to know what that means, okay? And also this is saying it's for a renal endoscopy through an established nephrostomy, okay? So our answer is going to be A, and if we look at our codes here, they not really telling me too much. So we're just going to go to the keywords. I have removal calculus from renal pelvis via renal endoscopy through an established nephrostomy. Okay. All right, so let's go ahead and look at 50060, which is an answer D, and that is for a nephrolithotomy, removal of calculus. Okay, so that's, if we follow those medical terms, if you've been attending medical terminology on Mondays with Ms. Tasha, nephro, we know means kidney, and we are in the kidney section here. And that's basically cutting into, making an incision into the skin to remove those kidney stones, okay? And it's pretty minimally invasive procedure, but this is not what happened here, okay? So that is incorrect. It doesn't mention anything about a nephrolithotomy, cutting into the skin for anything, okay? So we're gonna go ahead and get rid of that. And we're gonna look at 50130, okay? This is coding for a pyelotomy, okay? And what does that mean? Does anybody know what this means, pyelotomy? Type it in the chat. Ooh, great job, Brittany. So we know tomy is cutting into, and what is pile? That would be renal pelvis. So see, we're dealing here with the renal pelvis. So that is basically cutting into the renal pelvis, okay? But what it's saying here is that that's not being cut into. It's saying that it's the calculus is being removed from the renal pelvis via renal endoscopy through an already established nephrostomy, okay? So that's gonna also be incorrect. Let's go ahead and get rid of answer C. So we'll get rid of answer C. All right, and then let's go to, okay, let's go to 50580, I think this is. Yeah, 50580. This is for renal endoscopy through nephrotomy or pyelotomy with or without irrigation. With or without irrigation, installation, or uretopyelography, exclusive of radiologic service, with removal of foreign body or calculus. So this is also not going to be our code, because there's something more specific. Okay, I do see some keywords here. We have renal endoscopy through nephrotomy or pyelotomy, but we're going to get rid of that one because if we look over here at 50561, the parent says renal endoscopy through an established nephrostomy. So again, following those keywords, we had a renal endoscopy here through an already established nephrostomy, okay, with or without irrigation installation or uretropyelography exclusive of radiologic service, and with removal of foreign body or calculus, okay, and that's what was removed here was some calculus, okay, those stones. All right, so A is the correct answer. All right, and let me know if you got that. Talk to me in the chat. But going back to, you know, when you see words, let me go back to, so when you see these words and you may not know what they mean, like for instance, this pyelotomy, we don't run across that too often. You might just want to put cutting into the renal pelvis, or you might want to break down the term. What pyle means is renal pelvis, okay, because in this scenario, it might not say pyelotomy, it just might say cutting into the renal pelvis. So that's what that means. And then otomy is cutting into, okay? So just putting little tips like that. I always did that when I was studying. Really was helpful for me. So if it helps you, then I would say do that as well. And we're gonna go ahead and get back over there. Whoops, uh-oh. Sorry about that. Went a little bit too far. Okay, so we're going to get back to this one. And, oh my goodness, I lost track. Is it Miss Bennett?
Yes, ma'am.
Okay, take it away,
Okay.
Miss Bennett. Thank you.
We're still doing 2 minutes, right?
Yeah, that'll be fine, Miss Bennett. Thank you.
Okay. A 51550, B 51555, C 51555 with modifier 22, and D 51550 with modifier 22. A partial cystectomy is performed due to the prior administration of radiation. It is complicated due to extensive adhesions and required an additional 2 hours beyond the usual cystectomy procedure. What CPT code is reported for this service? Coders, your time starts now. Okay, that's time.
All right, perfect. Thank you so much, Miss Bennett. All right, I like this scenario. This is always a good learning scenario. I see some of us split on this answer. That's okay. Okay, so let's look at what's going on. We're only dealing with 2 codes here. We have 51550 or 51555, and we have some modifiers. So we have that modifier 22, which is the modifier for increased procedural service. Okay, so when there's additional time, when the work just when that procedure requires more work than what is typically required, things like that, we would use modifier 22, okay? All right, so we have a partial cystectomy due to prior administration of radiation. It's complicated because of extensive adhesions and required additional 2 hours beyond the usual cystectomy. Okay, so our answer is going to be B. Okay, so we're reporting this code without a modifier, although it is saying that this procedure is complicated and it took an additional 2 hours. Okay, so let's look at these codes. So the difference between 51550 and 55 is whether it's simple or it's complicated. And it clearly states in our documentation that this was a complicated procedure. Example, post-radiation, previous surgery, or difficult location. Okay, so because we have a code, so 51550, before I jump the gun on that one, we're going to go ahead and get rid of, sorry, all these clicks. We're going to go ahead and get rid of A and also D, okay, because this is not a simple procedure. Okay, so 51550 would be gone, and D is coding this as a simple but with increased procedural service. However, we have a code to indicate that. Okay, so when the code language includes already that this is a complicated procedure, there's no need to add an additional modifier to indicate that. Okay, so in this case, we do not need to append that modifier 22. We would just report 51555 by itself. Okay, so no need for the increased procedural service, again, because in this code language, it's already stating this is a complicated procedure. Okay, so B would be the correct answer. Okay, so how do y'all feel about that? You got that one? Does that make sense? And you might want to write next to that code, you know, like I do, like that little slash through the 0 that indicates do not, you know, put something there. So I would do that with like the modifier 22 next to it to let myself know not to report modifier 22 with that code. Okay. All right, so I guess I'll bring in some bonus scenarios because it looks like, let me go ahead and pause my screen so I can get to my other scenarios, because it looks like the scenarios that Ms. Rochelle had prepared for you all tonight, it looks like we went through them. That was great. You guys rocked it. And so we'll bring in a couple bonus ones before we end the night. Give me 1 second. Hopefully nobody's seeing my screen. Okay, all right, so let me go ahead. Let's see. Uh-oh. Okay, maybe not. Okay, here we go. Okay, and I'm gonna ask Miss Sarah if you can go ahead and read this one for us, and we will give them 2.5 minutes.
Okay, 2.5 minutes, and I apologize in advance for chopping up the words. Okay, we have A 45330, 45331, K 62.5, B 45331, K 92.1, C 45333, Z 12.11, K 62.5, D 45305, K 92.1. A 20-year-old patient presented to the hospital for a sigmoidoscopy due to history of bloody stools for 3 weeks duration. The patient was prepped for the sigmoidoscopy, and the sigmoidoscope was passed without difficulty to about 40 centimeters. The entire mucosal lining was erythematosis. There was no friability of the overlying mucosa and no bleeding noted. No pseudopolyps were identified. Biopsies were taken at about 30 centimeters. These were thought to be respective of the mucosa in general. The scope was retracted. No other abnormalities were seen. What CPT and ICD codes are reported? And time starts now, coders. All right, that's time, coders.
All right, all right. Thanks so much, Miss Sarah. And coders, get your answers in the chat. Fantastic keywords. Keep those keywords coming. A lot of, looks like we have a pretty close to 100% here. So great job on this one, because I know it's kind of a lot to sort through. So if we look at our answers, I see that they're all my codes here are pretty close together, especially A, B, and C, those procedure codes there. And then we have some additional codes coding from our diagnosis codes coding from our digestive system, and then we have a Z code there as well. So let's go ahead and look at what's going on. Oh, first off, our answer is B, okay? And our keywords are 20-year-olds, sigmoidoscopy, bloody stools, sigmoidoscopy, sigmoidoscope, no pseudopolyps, biopsies, scope, retracted, no other abnormalities seen. And if you notice here, I like to just kind of highlight. I learned this from Mrs. J, my repeat words, okay? Because the more that you have it in your scenario, the more, that's just one thing that's going to be popping out to you, that we know that this was a sigmoidoscopy. It says it again, and it says sigmoidoscope, okay? So that is one of our major keywords here, okay? It's the biggest thing I like to look at when I have multiple keywords that keeps repeating themselves. I really like to just kind of hone in on that. Okay, so let's go ahead and look. If we start out at 45330, we are coding here again for the sigmoidoscopy, right? We saw it 3 different places there, and it says biopsies were also taken. So this first one here, this 45300, this is coding for a proctosigmoidoscopy, okay? It's not the same as a sigmoidoscopy, okay? So this is viewing a different part of the colon, okay? This is just coding the sigmoid colon. This is the proctosigmoid, okay? And so that's going to be that's going to be incorrect, okay? All right, we're going to go to the next page, and the next code we're going to look at is 45330. And that is our code for our sigmoidoscopy, okay? I like that. This is our diagnostic though. So remember, if you place that DX next to there and you highlight that separate procedure, you're going to know that this is only coded when it's performed by itself, not when it's integral or related to another procedure. So more specifically, when a surgery is performed during that scope, and a biopsy is considered a surgery, anytime a procedure. So that biopsy is going to be a procedure. So anytime you have a surgery performed during the diagnostic is bundled. So I think we all know that by now. And so that means, and then if you look at your parenthetical guideline, it says this, it pretty much is saying the same thing. Do not report 45330 in conjunction, and it says this code range, one of those codes are 45331. I see them both reported there in answer A, and because of that guideline, diagnostic scopes are bundled into surgical scopes. That is why A is wrong, okay? All right, so I like 45331 because that is for the sigmoidoscopy with biopsy, single or multiple. So it doesn't matter how many are taken there. You would just report one code for the biopsies. And if we look down at 45333, that's for removal of tumors, polyps, or other lesions. And it doesn't mention that anything like that was performed. It says that there was no polyps that were identified. It doesn't mention anything about tumors or other lesions. So that is going to be incorrect code, okay? So we'll get rid of answer C. And then finally, if we just look at that diagnosis code, K92.1, that's for the melena, which is basically the bloody stools that this patient was diagnosed with, okay? All right. And that's it. So B is the correct answer. Anybody have any questions? If not, let me know you got it. And I think I have one more for you. Great job. Okay, so let's go ahead and move on to our last scenario of the night. And I'm going to ask Ms. Tiffany if you can read this one for us, please.
Okay. A, 50081, B, 50040, C, 50080, D, 50130. What is the correct CPT code for a percutaneous polylithotomy with dilation and basket extraction measuring 1 centimeter? Coders, you have 2 minutes. Ms. Tracy, that's time.
Okay, thanks so much, Ms. Tiffany. And how'd y'all do? Let me take a peek here. See what everybody's saying. Great job, Kim. Great job, Elaine. I like those keywords. Looks like, oops, I already revealed the answer. Sorry about that. But it looks like you all are saying C, and that is the correct answer. So what a way to end the night. I think we're ending on a 100% note. So great job, everybody. So real quickly, let's just walk through this. And let's go looking at my keywords, or sorry, looking at my answers. It looks like A, B, and C, they're all kind of close together. So let's go ahead and look at the keywords. We have percutaneous, oh my goodness, pyelostolithotomy. Sorry about that. Dilation, basket extraction, 1 centimeter. All right, I need to bring Miss Tiffany back because she did a great job on that word. I did not do so well. Okay, so anyways, let's look at these. So 50040, that's for a nephrostomy or nephrotomy. And following my keywords, I'm not saying it again, but we're looking for that pile word right there, okay? So we're gonna go ahead and get rid of answer B, okay? It's not matching what happened here. That's gonna be the wrong procedure. 50130, that is for a pyelotomy, okay? And again, we're looking for the pyelostolithotomy. Sorry. Okay, I'm getting delirious. Okay, we're gonna get rid of answer D. 50080, this is for a percutaneous nephrostolithotomy or the keyword that we're looking for right there, okay? We're just gonna say the keyword. So we're looking for that, and that matches. So it could be either the nephro or the pyelo, okay? So that's also, remember, one of our game changer words, so we can just box that, and this code could cover either or, okay? All right, and I like that. And that now it comes down to size. So it's this 50080 is for up to 2 centimeters, and 50081, which is in answer A, is over 2 centimeters, okay? And we're just coding for 1 centimeter. So we're right there at 50080, and we can go ahead and get rid of 50081, okay? So C is our final answer. All righty. Any questions on this one? I apologize for that word. That was a doozy. Thank you, Miss Patricia. You're always so kind to me. Thank you so much. Okay, perfect. So looks like that concludes our group study. I do have a couple more things to send you on your way. And again, keywords. So really in this section, keywords. Follow those keywords. I think that's why I like doing this group study. Usually I'm over there in E&M, so it's has a little different feel to it. So it's kind of nice to change it up a little bit. So it was my pleasure to be here with you all tonight. I want to thank you for allowing me to come in and study with you all. So final tips for tonight. Chun. This helps distinguish one code from another, and it helps to avoid mistakes, and it really saves a lot of time. So chun. Refine your keyword concept. Only highlight keywords relevant to your coding. Avoid those flowery words or those filler words, okay? So just kind of focus on what we talked about in the beginning when we went over our keyword concept. Just focus on what we talked about earlier, okay? The ands, the thes, all those filler words, we don't need to worry about putting those as our keywords. Always read your parenthetical guidelines. They are the supreme guidelines. So those guidelines rule, okay? So no matter how many we always say keywords, but really it comes down to guidelines first, and then if no guidelines, then you rely on your keywords. And I hope tonight you realize medical terminology is very important. We do have a medical terminology webinar every Monday from 8 to 9. Correct me if I'm wrong. I know we changed the time. I think it used to be 7 to 8, but now it's 8 to 9 Eastern. And you can sign up for that and just confirm that in your student resource center, okay? Right where you sign up for your group studies. And definitely a strong base on medical terminology makes you a better coder, okay? And keep on attending group study for more practice. I know a lot of you is your first time attending tonight. I want to thank you again. I hope you had a great time. Please take a moment to fill out the survey at the end of the night, especially our newcomers that is your first time attending. We always love to hear about, your first experience with group study. So please don't forget to just take a few moments to fill out the survey. And we want everybody that's here tonight to just go ahead and leave us a few words. Let us know what you thought tonight. I saw some aha moments, so share those with us in the survey. Also, that's a way for Mrs. J to kind of see too, how everything's going, because she doesn't always get to be in all these classes. So she definitely loves hearing from you as well. So go ahead and fill out the survey. And again, I want to thank you all for coming tonight. I want to thank you to my team, Miss Bennett, Miss Tiffany, Miss Sarah. You guys rocked it tonight. I know these are not easy words to pronounce, but you guys did an amazing job. So thank you all again so much.
You're welcome, and thank you. And coders, thank you for listening to me butcher some words tonight.
Oh, you did fabulous. You did amazing. I was like, oh gosh, look at Miss Bennett go. Miss Sarah and Miss Tiffany. Wow, I should have brought you guys in to say the words for me. That's terrible. So thank you, Miss Bennett and Miss Sarah and Miss Tiffany. I hope you all have a great night.
Yeah, good night, everybody. Good night, coders.
Thank you for having Miss Tracy. Good night, coders.
Good night, coders. Good night, Kim. I'm just kind of checking to see if there's any questions that I may have missed. Thank you, Miss Patricia. You're welcome. You're welcome. You're always welcome. All right, I don't see any questions, so till next time.